Hi, my name is Jahnavi Kishore, and here's an introduction to my project entitled Feasibility Testing of a Simple, Effective Prophylactic Therapy Against Heart Failure Using siRNA-Loaded Exosomes. Heart failure is a progressive and irreversible condition where the heart is not pumping enough blood. The disease is progressive and nearly always fatal within 5 years of diagnosis. Patients progress to heart failure after myocardial infarction, or MI, due to massive cardiac cell death during the hypoxic stress of MI. Could we prevent patients from progressing to heart failure after a heart attack? Treatment would have to be both timely, as disease-causing fibrosis advances soon after MI, and localized, since many targets of therapy, for example GRK2, which impacts cardiac remodeling, are dangerous to modulate systemically. Exosomes, tiny microvesicles normally secreted for intracellular communication, may hold real potential to be appropriate vehicles for therapeutic agents that may locally modify expression of, for example, the gene GRK2. I tested the hypothesis that a patient's own cells could be modified ex vivo such that the exosomes produced would be loaded with specific siRNA. These siRNA-loaded exosomes could then be injected locally into or near the patient's heart, allowing the siRNA to locally knock down expression and function of the target gene. Using GRK2 siRNA, I demonstrated loading of fibroblast exosomes using a simple method that could be easily used in clinical settings. These loaded exosomes maintained their integrity and functions in culture, as evidenced by their ability to reduce hypoxia-mediated cell death of fibroblasts treated with these exosomes. The next step would be to test these siRNA-loaded exosomes in an animal model of myocardial infarction-mediated cardiac injury. Thank you for reviewing my project.